Here are today's key developments in our coronavirus coverage. There's been another death from coronavirus in New South Wales. The 80-year-old woman died in a Sydney hospital overnight and is believed to have caught the virus in an outpatient's clinic. The state also recorded 3 new cases from community transmission. Victoria has added 12 new cases. 5 are linked to that Cedar Meats cluster. So the number of people infected as a result of that outbreak, specifically at that abattoir, now stands at 111. The last remaining COVID-19 patient in South Australia, Paul Faraguna, has walked out of hospital. The 68-year-old spent a month in an induced coma after contracting the disease on the Ruby Princess cruise ship. The state will relax some restrictions today. More than 38 million Americans have now filed for unemployment benefits since the middle of March. Another 2.4 million have joined the jobless queue just in the last week. New research has also quantified the human cost of a late move to the lockdown in the United States, estimating that tens of thousands more people died because of that. The British government has secured more than 10 million antibody tests to see if people have had the virus. It gives a result in around 20 minutes. The first in line will be health workers, patients and nursing home residents. And Spain's daily death toll has dipped below 50 for the first time since the middle of March. The country has started reopening after one of the world's strictest lockdowns. Okay, so let's take a look at some of those elements in detail now. So there's been another death from coronavirus in New South Wales. Reporter Lily Mayers has more from Sydney.
Well, we know the woman was 80 years old and she had been being treated at Concord Hospital. The woman caught the virus at an outpatient clinic in Concord. The Chief Health Officer, Dr. Kerry Chant, says there is no threat to the area. However, doctors were able to contain the spread to the woman. We learned the 80-year-old contracted the virus around 3 weeks ago. So sadly, she had been fighting this virus for some time now. Dr. Chant passed on her condolences to the family. Here's a little of what she had to say this morning.
She acquired her infection associated with an exposure in an outpatient clinical setting. And I'd like to send my condolences to that family. Of the 3 cases that we've had today, they're all under investigation, but obviously we're considering that they're locally inquired, so there's no clear-cut linkages between the cases.
That was the New South Wales Chief Health Officer, Dr. Kerry Chant. And Joe, as Dr. Chant said, those new 3 cases recorded in the state today are thought to be locally acquired, and the Health Department is still investigating where they originated.
Lily Mayers there in Sydney. Let's head to South Australia now. Restaurants and cafes there are able to cater for up to 20 patrons at a time from today. The state government decided to bring forward the easing of restrictions after recording just 1 confirmed case in the past 28 days. Premier Stephen Marshall says the economy will be opened in a safe and sustainable way.
As of today, we are taking those additional baby steps in our road to recovery and movement back to a COVID-safe environment in South Australia, and we're allowing those businesses that have been trading with 10 outdoors now to have 10 indoors, also with alcohol. So a small step. Our major step, of course, is occurring on the 5th of June, when we will be allowing indoor dining with alcohol right across the state.
South Australian Premier Stephen Marshall there, and the total number of coronavirus cases around the world has now risen above 5 million. Spain's daily death toll has dipped below 50 for the first time since March the 16th. The country recorded 48 fatalities in the past 24 hours. Spain has started reopening after one of the world's strictest lockdowns. There have been devastating scenes in Sri Lanka, where the coronavirus lockdown has caused significant job losses. In Colombo, 3 women were trampled to death in a stampede for a Ramadan handout. And there are growing concerns for Africa, particularly in the east of the continent, where some nations are dealing with multiple disasters, including coronavirus, floods and locusts. Meantime, in the UK, the Health Minister says antibody tests suggest 17% of people in London may have already had coronavirus. And US President Donald Trump has backed this year's G7 summit to go ahead, which may bring world leaders face to face. And another 2.4 million people have filed for unemployment benefits in the United States in the past week. So that means a total of now 38 million American workers have lost their jobs since the pandemic began. Here's North America correspondent James Glenday in Washington.
Well, in normal times, these would be absolutely horrific, unbelievably shocking. In fact, if you only go back 9 weeks ago, this would have been a record. But this fairly small figure, as you kind of alluded to, does pale in comparison with the total number of jobs lost. Nearly 39 million, 38.6. That's bigger than the whole population of Canada. Or to put it even in maybe a slightly better context, that's 1 out of every 4 people that was working just in February has now lost their jobs. And the other thing that's really worth noting with all this, it's now looking as though these job numbers are reflecting not just the fact that the United States economy has been shut down, because things are gradually starting to reopen. Quite a lot of forecasters expect that because jobs are continuing to be shed, it's because businesses are starting to adapt to this kind of new world where we now live in, where restaurants are not going to be as full if they can open at all. Other businesses are going to have more people working from home, and that might have a long-term impact on the number of jobs in this country in particular.
And James, the university team has taken a look at how the virus has spread through the US and what might have happened if different things were done at earlier stages. Just talk us through what that modelling has found.
So this modelling was essentially looking back at how much did that time where America kind of ummed and ahed about what to do about the spread of COVID-19, how much did that cost in human terms? And these modellers from Columbia University estimate that if America had shut things down just a week earlier, when other countries were doing much the same, then as many as 36,000 lives could have been saved. If they'd done things even earlier than that and kind of led the world and gone at maybe the start of March, maybe 83% of all deaths from the coronavirus could have been avoided. Now, they're just models, and models can often be wrong, but it does give you kind of an insight into how much those early weeks of inaction appear to have cost this country, which of course is now dealing with some 1.6 million positive cases, and of course there are probably many more than that within the community itself, and the death toll keeps rising. It's around 94,000. Now, the President, Donald Trump, keeps getting asked about this and whether he should have done something sooner, and today he effectively said he thought it was just a political hit job, and he said that he didn't think it should be taken too seriously. But certainly those models, Joe, have attracted a lot of attention in this country.
And James, the President has been getting out and about a bit more as restrictions are lifted in the US. Where's he been this morning?
Yeah, just a little bit more. It's one of those tricky ones because restrictions are being lifted, but they're not being lifted to such an extent that you can really notice a big difference, and more shops are opening, things like that. Donald Trump, however, is very keen to promote the fact that things are slowly inching back towards maybe something that looks a bit more normal. And he went up to a Ford plant in Michigan, which has been repurposed to produce personal protective gear and also ventilators. Now, he wanted to go there to talk about his administration's response to the coronavirus, but like many things, it kind of became a bit of an issue about himself, and that's because there was this debate: would he wear a mask as is recommended by health authorities, or would he choose not to? And as it turned out, he fronted the media not wearing a mask while everyone else was, and walked around, and there was a fair bit of breathless commentary, and then he revealed that he actually did have a mask, and it had its own little presidential seal, but he said he didn't want to give the media the pleasure of wearing it in front of them, and he just wore it during that factory tour. They're the times we live in the United States. Mr. Trump has also been getting a lot of questions about what's happening in the White House itself, because today he again said that maybe the G7 meeting, which was scheduled for just a few weeks' time, could still take place in the United States fairly soon, and at the White House itself, which of course has been dealing with a COVID-19 outbreak, and a lot of the residents there are getting tested regularly, including the President, who was tested again this morning. And he gave kind of this, I don't know whether he was teasing the press or not, Joe, when he gave this answer, but it's worth listening to anyway.
And I tested very positively in another sense. So this morning, I tested positively toward negative, right? So no, I tested perfectly this morning. Meaning I tested negative.
Have you taken the antibody test yet?
But that's a way of saying it. Positively toward the negative.
Positively negative, Joe. And his staff did actually clarify that he did test negative after all that.